tó ṣèdánwò tó gbà wọ́n náà kan tẹ̀lé ẹ dákun jẹ́ kó ti fèrè pátá àmọ́ wọn ló kàn yẹn káàkẹ́ bàjẹ́ gbà ìyẹn ló ṣe pàtàkì pátá. nǹkan kan ṣoṣo sẹ́ làkẹ́bàjẹ́ mọ́ wọn ṣe ò ìyẹn sì tẹ́ mi lọ́rùn pátápátá.
Feel the clarity, feel the connection. Emirate Radio, 98.5 FM.
We are the voice of the people. The voice of the people. Emirate Radio, 98.5 FM.
As a people with one song, with one voice, we're a nation undivided and poised. We will take a stand and build our land in faith to defend what is ours. Here we are as a people with one heart for one cause. We're determined to rebuild and restore. We're freedom, rise, and truth prevails. Our land where there's hope for us all. Our land where there's hope for us all. We'll defend our land. We believe in this nation, and we know we'll get there. We'll defend
is not a privilege, it is a basic human right, and the strength of any society is measured by the quality of health care available to its people. From primary health care centers in rural communities to general hospitals in urban areas, from maternal care to disease prevention, the health sector remains one of the most critical responsibilities of the government. This is the scorecard, the program where performance is the only language, and today on the program, we turn our focus to the health sector in Kwara State, examining the progress made, the challenges that remain, and what more needs to be done to ensure accessible and quality health care for all. My name is Oluwadolapo Bamigboye, and this is Emirate Radio 98.5 FM. Do know that you can watch us live on all our social media platforms at Emirate Radio 98.5, and you can also visit our website to listen live as well at www.emirateradio.ng.
Nigeria stand up, Nigeria stand up. Join me, say yeah. We're a great nation. Oh, God. Ooh.
Today we are joined by the Honorable Commissioner for Health in Kwara State in person of Dr. Amina Ahmed El Imam, who is responsible for overseeing healthcare delivery, policy implementation, and the general well-being of residents across Kwara State. Honorable Commissioner, good afternoon, ma.
Good afternoon. It's good to be here.
Yes, thank you so much for joining us on the scorecard.
My pleasure.
All right, ma. Now, moving right into the order of the day, the business of the day. Now, I would like to ask you, ma'am, that many residents still complain about limited access to quality health care. What are the concrete steps that the ministry is taking to ensure health care services are accessible, affordable, and evenly distributed across Kwara State?
Talking about access in Kwara, it's actually one of the strengths of this government, led by His Excellency Malam Abdurrahman Abdurrazak. Access means how easy is it for people to locate physically a health center? How easy is it for them to afford the services rendered? Do they have the knowledge? Do they know where the facilities are located? Can they afford it? We have touched on everything that contributes to improving access to healthcare in Kwara State. Malam Abdurrahman Abdurrazak met the number of people enrolled on state-sponsored health insurance at about zero. Almost nobody had free premiums paid to cover them for a full year to provide them with access to healthcare. To date, depending on how you estimate it, we have close to 100,000 Kwarans for whom we pay premiums, to ensure that they can access healthcare if and when they need it. This is across multiple platforms. We have Kwara Care, we have a lot of vulnerable populations. We are talking about the elderly, the less abled, the pregnant women, children under 5, who get free coverage in Kwara State. We are not where we want to be, but we are a long way from where we used to be. Additionally, before now, most facilities were decrepit, they were derelict. Ceilings used to fall on patients and healthcare workers. Most of that has been renovated. You are aware that 193 BHCPA facilities are now functional, providing the minimum service package of primary health services across this 193 wards of Kwara State. In addition to that, there is no local government in Kwara State that has not had renovations of several, not one, primary healthcare center and secondary health facilities. being done. So we are renovating, we are equipping, we are staffing, in addition to providing free health coverage for people to improve access. One of the standout programs that has democratized access in Kwara State is the medical surgical outreach that is being run in Kwara State. Madam Abdurrahman Abdulrazak took healthcare to the doorsteps of people in an unprecedented move, in a move that is not very popular. We carry out free diagnosis, free consultation, free treatment, and referrals for patients across the 16 LGAs for several years now. The 2025 medical surgical outreach covered over 10,000 people with free drugs, free operations. I mean, this is in the public space, and we are planning to even increase that in 2026. That's in addition to providing free health care, free health insurance. We're also working with the Federal National Health Insurance Agency to provide free cesarean sections in 5 secondary health facilities in Kwara State, known as CMOC centers. That's General Hospital Offa, General Hospital Kayama, Kwara State University Teaching Hospital Ilorin, Aisha Buhari Mother and Child Hospital, and I think Subi Specialist Hospital. 5, where a woman with complications can be treated for free if she needs C-sections and so on, just to again expand access. Don't forget that Kwara State government under Madam Abdurrahman Abdulrazak was the only state that was doing free vesicovaginal fistulae repair in Nigeria for free, multiple times, before the NHIE took that up and began to also support that. So multiple activities have gone on to ensure that we democratize access, improve access to healthcare for Kwarans.
All right.
But more will be done.
All right, thank you so much, ma. When you were talking, you talked about personnel. And in Nigeria, we've always had the JAPA syndrome for the doctors. So how is the state managing that particular situation? Do we have enough hands on deck?
Unfortunately, we are yet to have enough hands on deck, but we have not ever relented. On multiple occasions across the entire sector, indeed across the state, there have been recruitment exercises just to ensure that we sustain the level of staff we have, and in many cases even increase the number of staff that we have to counter the JAPA syndrome. We've had a few instances of actual JAPADAs where we've been able to get back the staff that we lost to competitors into the state's civil service program. But crucially, every year there are multiple interventions where we are either replacing experienced hands using the one-for-one scheme that His Excellency Madam Abdurrahman Abdulrazak approved some years ago, or we are doing mass recruitments just to plug the gaps that we find in the system. We just concluded a recruitment of 150 nurses for the secondary health facilities in Kwara State. We, before that, recruited about 75 health workers for the teaching hospital, Kwara State University Teaching Hospital. To complement all of this, the primary healthcare subsector received a huge boost through the recruitment of over 1,000 staff by the Local Government Service Commission. All of this is within the past 1-2 years. So more is also happening. In fact, as we speak now, through our partners, the European Union funded SERA program implemented by the UNICEF and the UNFPA, we are trying to recruit community midwives. We went into the communities and we didn't get midwives to recruit, so we are creating them. We have a scholarship program funded by partners very generously that I'm really excited about. And these community members are being recruited from the grassroots. We will sponsor their education. We will pay them a stipend. After 2 years of studying to become community midwives in Kwara, we will deploy them back to their communities, not headquarters, the grassroots, to ensure that we crash maternal mortality and morbidity in Kwara State. All of this to say, again, we have multiple activities going on to improve the staffing in the health sector. However, something very crucial that I should mention is that it's not enough to attract, you must retain. Yes. And it is to this end that His Excellency has twice, in his second term alone, twice improved the salaries of all health worker categories, con-nurse, con-health, to ensure that we are attracting the best hands and we are retaining them. So we were paying equivalent to the teaching hospital in federally owned teaching hospital to minimize the impact of lateral JAPA within the state, from the state to federal, or from our state to other states. More is being done to see how we can further incentivize our health workers when we attract them. We also pay a lot of allowances, accruitment allowances, residency training fund, and so on, just to keep our hands when we get them. Having said all that, I must mention that the the hands that we have in the state are people I'm proud to work with. They are committed. Our doctors are fantastic. Our nurses are dedicated. Our pharmacists are crucial. They are doing good work, and we recognize their contributions. We appreciate it, and we look forward to them doing even more to sustain the system, even as the state is doing a lot to improve their experiences.
All right, thank you so much. And when you were talking, you talked about maternal and child mortality rates, which is something that's remained critical in Nigeria. What specific program is the ministry implementing to reduce maternal and infant deaths in the state?
Okay, so maternal and infant deaths are something that is quite heartbreaking, to be frank. It's unfortunate that we have the statistics that we have as a country, but I must preface by saying it is the priority for government at all levels. The government of President Bola Ahmed Tinubu, through the Minister Professor Muhammadu Ali Pate, have done a lot of work to prioritize maternal and infant mortality. So it's on the front burner. Naturally, as a state that is very serious about health of all, especially the least privileged and vulnerable, the Malam Abdurrahman Abdulrazak-led government has prioritized maternal morbidity and mortality reduction. So when I came into office, the first thing I did was revitalize a committee that was supposed to be doing this. It's called the Maternal Perinatal Child Death Surveillance and Response Committee, MPCDSR. That committee has made it such that we are mandating everyone working in the health sector to report all instances of maternal deaths, whether it's during childbirth, around childbirth, or the child itself that we lose. It must be reported. We sit down, we deliberate what went wrong. It's not a witch hunting, so we don't want to, it's not a witch hunt, so we don't want to scare staff off. But now every death is a reportable incident that we must address at the root cause to prevent a reoccurrence. That's one activity. We have also ensured that reporting is mandatory, no suppression. We don't punish you if you lose a patient. We'll just ask you what went wrong. We take notes and we correct it. So we have identified training gaps, and we have plugged that again through His Excellency's consistent support for capacity building in the health sector, and through the partners, again, EU SERA, that has done CMONG training, EMONG training, a lot of simulations for us, and many other capacity building activities. They also fund validation, which means we now validate all data. Nothing is suppressed, nothing is padded. We put it out there. Something very crucial that I must mention is that we're also trying to expand the Kwasuth maternity wing. If we are lucky and it goes through partner support, we'll have more space to bring on complicated cases and work on those to prevent morbidity and mortality associated with less developed health facilities handling such cases. Another thing we are doing, again, the community midwifery thing will help considerably to reduce maternal and infant morbidity and mortality. But I want to end my response on a positive note, and that is the fact that we also have some community midwives and some other ad hoc staff that are recruited through multiple platforms through the Kwara State Primary Healthcare Development Agency that are in the communities and in our primary healthcare centers taking deliveries and ensuring that we use skilled birth attendants at all times, even in the communities, not TBAs that may not have the requisite skill to deliver safely. It's important to know also that the state government is not relenting in its efforts to elevate even the teaching hospital so that we are able to receive more births, expand the number of neonates that we attend to. Center Borough is being equipped, it's being renovated, and all of that. That's the Children's Specialist Hospital. Kwara State has the lowest infant mortality rate in Nigeria, under 5 mortality rate in Nigeria. So it's the best state in which a child can be born and raised. All right. And we intend to keep it that way.
Thank you so much.
May God help us.
Amen. So if you're just joining us, this is the scorecard on Emirate 98.5 FM. And the guest in the house is the Honorable Commissioner for the Ministry of Health in Kwara State, in person of Dr. Amina Ahmed El Imam. Now, Honorable, I would like to ask, recently we had the Lassa fever outbreak. And fortunately and good enough, Kwara State was not packed. And there was a news that came up but then it was debunked that there was no outbreak of Lassa fever in Kwara State. Now, what strategies were put in place that brought about this achievement?
Okay, so you see, the way to know if a sector is working is when you hear nothing,
Yes.
particularly in public health. So when you do your job very well, people don't know you exist. We work extremely hard. In fact, the last person I chatted with before I started this program is the state epidemiologist. We are doing a lot of backing and forthing on how to ensure that nothing gets out of hand. So we've been lucky in Kwara, because no matter how hard you work, there's, of course, providence, there's luck, there's God being on your side. What has helped us so far, there was a time when we were surrounded by cholera. Every state had cholera. There was a terrible outbreak. And luckily it didn't come to Kwara. We were plugging all holes and making sure nothing happened, and God helped us. Similarly with Lassa, it was quite a big problem, unfortunately, across the country. And our hearts are with those that were sick or that were lost. But we're also, again, lucky that it wasn't a bigger issue in Kwara. We did have a case of somebody who came from Ogun State. He went to Ondo State, then came to Kwara. When he fell sick, he was directed to come to Kwara. We attended to him. A few people were exposed, so we did a lot of preventative, prophylaxis, just to ensure that they didn't fall ill. And to the glory of God, it was handled without any severe issues accompanying that. Unfortunately, we lost that person, but that was it. He was already really sick by the time we got to know about it. So for us Kwarans, we are having multiple interventions where we let Kwarans know that this is what causes Lassa fever. Keep rats out of your home. Don't dry your food by the roadside. Keep your food covered. Avoid exposure to these multimammals and other rats and their droppings. And sensitization goes on and on and on, using multiple platforms. For instance, our Facebook handle, our social media, other social media, Twitter and Instagram. Then we have a program, Kwara Health Gist, too, on radio, that everyone tunes into just to ensure that they are informed, and that has helped us. We're also working in conjunction, because health is everybody's business.
Yes.
We're working in conjunction with multiple partners like yourself to say, Kwarans, keep your neighborhood clean. If you don't cut the grass, you don't drain the swamps around you, you don't flush, you don't keep your neighborhood clean, disease will come. It's natural, it's inevitable. No amount of hospital building, no amount of prayers can solve that. So we're telling people at every opportunity to take responsibility for their own health, and things are improving. We're working with other ministries, including environment, agriculture, livestock, NOA, that's the National Orientation Agency, and so on, to also improve the level of health literacy, awareness, environmental cleanliness that can prevent disease outbreaks.
All right, just to add to what you've just said, I would like to ask a follow-up question, which is, how prepared is Kwara State in case of in handling disease outbreaks and other public health emergencies?
Okay, so diseases will always pop up all around the world. It's inevitable. But in terms of preparedness, I'll say Kwara is doing exceptionally well. And this is not new. Under Malam Abdurrahman Abdurazak, it's a culture. It's something that has been ingrained in us at the Kwara State Ministry of Health. If you recall, in 2020, during the COVID outbreak, Kwara was one of the best performing states in terms of its response. Kwara came fourth nationwide, if I recall. And recently, in November 2025, the SBM Intelligence Index for Health Preparedness also came out. And the HPI showed that Kwara was one of the best, if not the best, prepared state for outbreaks in northern Nigeria, and one of the best in the entire country. If you also look at the budget this year, His Excellency has met the Abuja Declaration requirement of 15% of the total budget going to health. So the team is prepared. We have had extensive amounts of training from the grassroots at the local governments, at the wards, to the state. We have a very capable incident manager in the Director of Public Health. We have a state epidemiologist that also is aware of her role and knows that prevention is better than treatment. So we are constantly on our toes to prevent outbreaks, but when they do occur, we nip them in the bud immediately. If you notice, we just heard on social media that there was an outbreak in NYC camp.
Yes.
I called their attention to it, and within 3 hours, we had facts on the ground that there was no such thing. There is this desire to grow your social media account, so people just create phantom diseases where they do not exist. Unfortunately, it distracts the state government's apparatus and funding from actual problems by chasing ghosts that do not exist. We deployed the entire state apparatus to the NYSC camp. We sat with the management of the NYSC camp. Nothing of such. So we went around just sensitizing people. If you see this, let us know. We are going to release emergency numbers very soon, where people can reach us for any kind of emergency, whether it's public health or medical emergencies. It's going to be toll-free, but even before it becomes toll-free, I think I'll just send out the numbers so that you see something, you call the ministry immediately. We'll be on top of it in a matter of hours or at the most within that day. All of this to say that, again, it is a collective responsibility. We can only act on information that the people give to us.
All right, thank you, ma'am. You spoke on Kwara State Health Insurance Scheme.
Yeah.
Yes, ma'am. I would like you to briefly explain that and how residents can have access to affordable healthcare services in the state.
Okay. So the insurance I talked about is of many kinds. Using the health register, the social register, I beg your pardon, it's possible for the health insurance agency to see who are the least privileged among us. And as a result, we are able to put them on health insurance tailored for the vulnerable among us. Consequently, we have many people who are financially, challenged on our register that we provide health insurance for. Every year, His Excellency spends hundreds of millions providing health insurance for the least privileged in Kwara State. Similarly, we pay, and let me phrase this very well because we are taking it for granted.
Okay.
We have not owed counterpart funding for the Basic Healthcare Provision Fund in the past 5-6 years that His Excellency has led. What this means is that we are now able to provide health insurance on the Basic Healthcare Provision Fund, BHCPF, to Kwarans. Every year we renew their license. I'm talking, our grandmothers in the village are getting free healthcare. Nobody's talking about it. You know why? Health is intangible, it's invisible. But literally, ask them. They will say, "Mokuku nika di me infin ho." They will bring it out. Your younger ones who are mothers in the villages are getting free healthcare. It's quiet because they just walk in and get treated for free. But there are thousands of them, tens of thousands of them, because we are paying counterpart funding as and when due. Now, if you want to procure health insurance for yourself, it's 18,500 if you work in the formal sector. You can contact the Kwara Health Insurance Agency on their toll-free number 0800 100 101. 0800 100 101. That's 0800 100 101. You can call them. If you check their website also, you can get information from them. That's kwaracare.com.ng. kwaracare.com.ng. That is where you get all the information about registering for your health insurance. God forbid you have malaria today, you will spend more than 18,500 in one treatment, let alone if you have typhoid or diarrhea and other diseases. So it is such a good investment for every head of household to enroll themselves and their children on health insurance. To further increase access, His Excellency Madam Abdurrahman Abdulrazak has done the unprecedented in Kwara. For the first time in the history of Kwara, Kwara is half a century old, more than that. For the first time in the history of Kwara, we are going to be registering all civil servants in the states on the Kwara Health Insurance platform. Civil servants and their families. So we are looking at tens of thousands, approaching 80 to 100,000 Kwarans who will be registered on health insurance, where a token will be charged from their salaries and to provide health insurance for themselves and their family members. That is unprecedented. It's important. It's crucial to note that. So access will improve, out-of-pocket expenditure will crash, quality and quantity of health delivered will improve.
All right, thank you so much, ma. And finally, just briefly before we go, I'd like you to list at least some of the achievements in office that you've...
My achievements?
Yes.
My achievements, I like to say they are all the achievements of His Excellency, because that's his vision. We are just executing. It's crucial for you to note that we had 0 tertiary health institutions in Kwara when he took office. Today we have 3. One of them has just got MDCN accreditation. Additionally, 0 to over 100,000 people on health insurance, unprecedented. 10,000 people for medical surgical outreach last year, which will increase by the grace of God this year, unprecedented. Immunization activities all across the state. We are reducing zero dose in para, reducing killer childhood diseases. Those are worthy of mention. I also want to mention that staff are being recruited and they're happy. That's something I'm incredibly proud of. Our emergency preparedness and response, top notch. I'm incredibly proud of those too.
All right, thank you so much for your time this afternoon, ma'am. And this is where we'll be drawing the curtains today on the scorecard. And with me in the studio has been Dr. Amina Ahmed El Imam, the Honorable Commissioner for Kwara State Ministry of Health. And just as a reminder, healthcare is not just about hospitals and doctors. It is about life, dignity, and the well-being of every citizen. On Scorecard, we'll continue to ask the questions, track the progress, and ensure that leadership remains accountable to the people. Thank you for listening to Scorecard on Emirate 98.5 FM. My name is Oluwadolapo Bamigwe, and until we meet on the next edition of the program, good afternoon.